then you had mentioned about, is there any way that we can report drug-seeking behaviors from an outpatient setting? So I'm not aware of, and I looked this, I'm not aware of reporting for just drug-seeking behaviors. Then you can refer to local law enforcement, to DA, but just for seeking, I'm not really aware of any way to report that. But I think we should look at it a little bit deeper too. So like if a patient is seeking a medication, usually that tells us that there's something underlying going on, because the patient, they just don't want to be on the meds, right? So if it's underlying ADHD, if there's an addiction issue, then it might be a better approach to pursue rehab or some kind of treatment with that, rather than looking at it from like reporting it perspective. Of course, you make your clinical judgment on how you want to treat the patient, whether you want to keep seeing them or you say that you can't see them anymore. But yeah, I think switching that lens from trying to report them to trying to see how we can help the patient seems to be the more better thing that we can do for them. And I know it's frustrating too, because these patients can be very frustrating for us to work with, because they're the ones that really test our patients. So it's definitely a headache dealing with these patients too. But I think just having a level of empathy for them at least helps me stay grounded.